Good morning, everyone. If it's morning where you are, we are going to wait while everyone gets in from our waiting room, and then we will get started on our webinar this morning on alcohol policy, and with our expert Maureen. And if you could just hang on one second, we'll get started as soon as we get everyone in the room. Wonderful. Looks like we slowly have people joining. Good morning and welcome. Okay. Okay. Good morning, everyone. It is the top of the hour, and I want to respect everyone's time and make sure we give Maureen as much time as possible, and y'all as much time as possible as well. So, and we're hot, sunny Florida. So go ahead and as we get started, we'll see who's here in the room. I will just share with you that my name is Erin Ficker. I'm one of two prevention managers here at the Great Lakes PTTC. We are excited today to be presenting alcohol policy, policy and prevention, understanding effective alcohol policy strategies. This webinar is the first of 3 in a series. You don't have to attend all of them. You can if you'd like. I think they're a great series. And we are Great Lakes PTTC. Like I said, we are funded by SAMHSA under the following contract numbers. If you can, just as a quick disclaimer, like I said, we are funded by SAMHSA, and what you hear today is the opinions of and views of our speaker and do not reflect the official position of the Department of Health and Human Services or SAMHSA. There's no official support or endorsement that should be ascribed to this presentation. So that's our morning disclaimer. Thank you all for being here. We at the Great Lakes PTTC believe that language matters and words have power. We use person-first language that is affirming in the application of our evidence-based and culturally informed practices. We use that language in our work, and we ask that in any comments that are in the chat that you try to use that same affirming and person-first language. We can move forward. Just a few housekeeping things before I introduce our speaker. If you have any technical issues, Shannon Cassidy is here to help. You can go to the bottom of your screen and select chat and select Shannon and chat with her directly, and she'll take care of anything you need. There are captions or a live transcript if that would be helpful. Use your Zoom toolbar and enable it under the More section and select the captions, show captions option. Sorry, I got lost in my own conversation there. So if you have questions for the speaker, please go ahead and put them in the chat. We will try to keep track of that chat the best we can. We will direct you at the end of this to a short survey and would appreciate it just greatly if you could take the time to fill it out. It just takes a couple minutes. We will provide certificates at the end for those who attend the full session. We cannot provide those to you if you are not here for the entire session. Your name also needs to be accurate in Zoom. So if you have a phone number listed or someone else's name of your agency, something of that nature, please go to the ... at the top of your image and select rename. Make sure that's correct, and that is the name that will appear on your certificate. So make sure you get the correct certificate for those of you who can attend the entire webinar. Okay, I think that's my housekeeping. Before we can we stop sharing just a second, Shannon? And before we get started, I would like to take a moment to introduce our speaker. And Maureen, is an expert in alcohol policy and is currently the director of the Wisconsin Alcohol Policy Project at the Medical College of Wisconsin Comprehensive Injury Center. She has decades of experience in public health policy and systems change and is currently the co-chair of the Wisconsin Public Health Association and Public Affairs Committee. She is truly an expert in this topic and has much to offer us today and in the following webinars that we will be doing in the coming weeks. So I will turn it over to Maureen to introduce our agenda and get us started. Maureen, anything else you need from me before we get started?
I think we're good. I just have to get my slides up and I will share and get.
Wonderful.
And okay.
There we go.
Excellent.
Great. I am going to just say thank you all for being here. Please feel free to use the chat. We will be monitoring it. And I'm going to turn it over to Maureen.
Great. Thank you, Erin. And thanks. It's really an honor to be here today to talk to you about something near and dear to my heart, alcohol policy. So we'll talk about what it is. We'll talk about the role of public health in advocacy. And we will talk about lobbying fundamentals. I'll give you some, I think, really solid tips about what you can and can't do. There's always nuances in different states, so we'll have to keep that in mind. And making sure that as we do this work, that we're building that equity lens, building relationships with key stakeholders, and then we'll have a wrap up and questions. Our learning objectives today is really looking at alcohol policy in a public health context. We will go through steps for initiating and updating alcohol policy in different settings. We'll consider ways to incorporate an equity lens into policy development and modification efforts, and we'll describe key stakeholders and the importance of those strong relationships. So if you haven't already, please go ahead and put your name and organization in the chat. And I believe we have a poll to get us started this morning.
I see lots, as we start those polls, I do see lots of names and organizations here in the chat from all over the country, which is always exciting. So we have people from Michigan and Florida and North Dakota. I see folks from the Rocky Mountain area. I think maybe that's Indiana. So take a time to answer that poll as well and describe your work on policy. Are you an expert, a novice, dabbler, no experience? We welcome you all here. And what roles have you played in advocacy? So is that a spokesperson, content expert, presenter, lots of options there. So go ahead and take the time to answer that. I would love to hear, helps us think about how we are going to focus our time today. We have more folks from Michigan and Wisconsin. Wonderful.
Yay,
Salem.
Wisconsin.
Oh, Salem, Oregon. My family home. Indiana, Michigan representing. Oh, Stevens Point. Thank you for clarifying. Phoenix House in California, Massachusetts. Oh my goodness, all over the country. I can't keep up. You guys, this is amazing. Thank you for being so open and sharing. And I think we have a good number of participants if we want to share that poll. Maureen, it looks like we have mostly dabblers and novice folks here in their experience with policy work. And the role that we see people playing most is work to empower others, which I think is wonderful. And we see some people who are spokespeople, but mostly we see networker and work to empower others, which makes a lot of sense to me knowing the prevention field. So good to see that. Thank you guys for sharing. I'm going to go ahead and we're going to stop sharing that poll. And we will move on. Again, if you have anything, please feel free to add it to the chat as we go. So back to you, Maureen, now that you know who our audience is.
Great. And it's great. I really appreciate folks answering the poll. That really does help us kind of understand what your experience has been. Just really quickly, a little bit about me. That's me on a horse when I was 2. So love horses, and both my daughters have ridden, and my youngest is actually jumping over that little jump. Um, and for this work, I've worked on political campaigns. I ran Smoke Free Wisconsin, which we passed 2 tobacco tax increases, prevention funding, and the Smoke Free Air Law. I've also worked for an endowment that really focused on systems change. And now I'm with the Wisconsin Alcohol Policy Project. I did chair an ad hoc committee for our state council on alcohol and other drug abuse that has 61 recommendations for reducing alcohol use in our state. And I'm currently the co-chair of the Wisconsin Public Health Association's Policy and Advocacy Committee. So I feel like I've pretty much worked in public health almost all of my career, and really have kind of that niche on public health advocacy. And so we're going to talk about, you know, the essentials of alcohol policy. So here's a definition from the National Association of Alcohol Abuse and Alcoholism. Really looking at, the manufacture of alcohol, production, who sells alcohol, where people can drink alcohol, and how we respond to alcohol-related problems. So the goal, and I'd love it if folks just gave a thumbs up if you've seen this triangle before. It's an epidemiology triangle. And this was outlined back in 1987 by the Institute of Medicine, but it was around even before then. And, it was really kind of that understanding that alcohol problems are not like just an individual issue. Though I have to say the alcohol industry likes to paint it that way, but that's not really the case. Um, there's really a number of different factors that go into how an individual reacts. We also look at, the host, and that is the alcohol beverage and itself, or ethanol. And while ethanol is the same, right, that it's always been, how it is packaged and marketed and presented to the public is changing, and it's changing even faster now with ready to drink cocktails and lots of other kinds of, they look like energy drinks, right, the binge drink in a can, so that certainly has changed. um, and in terms of the individual, it's really, there's traits that affect your own susceptibility and vulnerability to the effects of alcohol beverages. So there's genetic, there's definitely an environment that may have shaped your individual response, and social norming. And being from Wisconsin, we do a lot of social norming around alcohol. Most people have beer at 1-year-old birthday parties, and I don't think that's common in the rest of the country. And then of course the environment, the physical, the interpersonal, or the social surrounding the use of alcohol, that really regulates the person's exposure to it, and mediates their risk. Um, this is both a micro and macro environment, such as like the legal environment. So if you're from a control state, and those laws are a little bit different than a state that I'm from, where it's, mostly local, but a statewide framework that drives the alcohol environment. And then of course the minimum age purchasing laws and enforcement of those, and zoning. The economic environment, how much does it cost to drink? The excise tax, the promotions, and the normative environment, which is general attitudes and beliefs regarding alcohol. I know that sometimes like yesterday I testified in front of a committee, and I felt like, they're all pro alcohol, rewriting all of our laws in Wisconsin, and I felt like the person that just brings the room down. Because I was the only one talking about the problems with excessive alcohol use. But there's mass media, of course, and how the media portrays alcohol. And of course, the physical aspects of the drinker's immediate environment. So our job is really to kind of look at this and figure out where we can have impact. And I would argue that our main focus should be on the comprehensive primary prevention on alcohol policy, um, because that's where we can change the most people. This is not to say that individual efforts and interventions are not important. I think they are very much important. But how can we impact a population and kind of stop problems before they get going? So now I'm going to share kind of the goal of alcohol policy. So we want to think about negative consequences of excessive alcohol consumption. So think about drinking and driving laws. So if you get an OWI, that can be a really big issue. Underage drinking laws, a negative consequence that can go on your record. It can cause you problems later on. And how do we kind of enforce our laws, and how rigorously are they enforced? Um, and then if we look at the individual influence um, of risky alcohol consumption, you can think about what what can be done in order to change that. Well, we can close our bars earlier, or not have them open, or alcohol sales at 6 a.m. Right? And many of you across the country may have been experiencing this, but for us, the Milwaukee Brewers, would always cut off alcohol sales at the seventh inning. But now that they're moving so fast, they actually made a decision to cut it off at the end of the game, and then decided that really wasn't a great idea. And so they moved it back to the seventh inning, but it's not as much time, right? So ending alcohol purchases, before people get in their cars is another way to look at risky alcohol consumption practices. And then reducing risk factors associated with alcohol related problems and consequences. So this is where I think about underage access, um, you know, and making sure that communities have compliance. How do we think about like alcohol density, for example? Like um, if we have so many places that have advertised alcohol, we could kind of bring that back, and we could reduce some risk factors, because there's pretty good evidence about things that happen in places that have high level of alcohol density. And then disincentives for individuals and organizations contributing to risky alcohol behaviors. So what would those be? Well, potentially the law enforcement could run sting operations. So I'm not talking about alcohol age compliance checks. I'm talking about a sting operation looking for bartenders that are over serving patrons that are already intoxicated. So that could be a disincentive to contribute to that risky alcohol behavior. And then, of course, fines for organizations that sell to minors or establishments. They can lose their alcohol license. I also wanted to talk about some of the sample alcohol policies. So I talked a little bit about regulating alcohol density. We can look at increasing alcohol taxes. There's multiple ways to increase the price of the product. It doesn't all have to be taxes, but that's something to definitely look at. I bet many states represented here have dram shop liability. That means, there can be a consequence to over serving someone who then goes and harms themselves or others. Think about how long is alcohol available for sale in your state. You know, our legislature a few years ago decided that the deer hunters needed to be able to buy beer before they hit the deer stand. And so we changed it to 6 a.m. that you can buy alcohol. So, but we do stop sales at 9 p.m. I'm sure you all have different, variations on when you can buy alcohol. Um, oh, I'm sorry. I was talking about hours of sale, day of sale. Many states have, no alcohol sales on Sunday, although that seems like it's changing too. And then electronic screening and brief intervention. Um, this can be an important skill to have. You see this in, like Espert or other tools like that in healthcare settings, but we also know this electronic screening and brief intervention can be done in many other locations, like schools and court systems. And then, of course, enhanced enforcement of laws prohibiting sales of minors. Um, And hopefully those are really working in communities. In one of our large cities, we just had 134 underage drinkers caught in one bar. It was the very beginning of the school semester. But amazingly, that bar is still operating. So now we're going to do a quick quiz. You didn't know you were going to get a quiz, but here you go. We've got another poll to apply what you've learned. And so if Shannon or Aaron want to pop up the poll?
Great. And it looks like our question here is about applying what you've learned. So the goal of limiting days and hours is to just have some answers there for you: to decrease negative consequences, influence individual risky alcohol consumption, reduce risk factors, and develop disincentives for individuals. So I see we have a whole bunch of answers coming in. I think you can just make one choice, but we see kind of an even split as those things are coming in. And actually, we're starting to see, oh, it's just all over the place. Thank you guys so much. I mean, you're just like 30 more seconds, maybe 20 to finish answering this. If you haven't taken that time, just make an educated guess, jump on in there. And it looks like after those 20 seconds, our winner here with 47% is to reduce risk factors associated with alcohol-related problems. And
Ta-da! And they're right.
ta-da! Yay! Yeah. So great job, guys. Thank you all for participating in that. I'm going to stop sharing and we'll move on to see what else Maureen
I
can
think
share
there's
with us.
another
Oh, there's
poll.
another poll. That's right. Sorry.
Yep.
Okay. So the goal of alcohol density is to and I guess the goal of reducing alcohol density. So decrease negative consequences of alcohol consumption, influence individual risky consumption patterns, reduce risk factors. These are similar, the same choices. If you're having a problem with the poll or you can't see it, feel free to go add something to the chat there too to answer the question. And we are seeing pretty good response. I'm going to give you guys about 30 more seconds. And wonderful, wonderful. About 50% of people take it, again, just best guess, best guess. You're not gonna, it's not gonna influence your certificate. So feel free to put yourself out there. It looks like again, we have a fairly clear winner with a runner-up. The third option, which is to reduce risk factors associated with alcohol-related problems. And that looks like, and Maureen gave us a thumbs up.
Yep.
Nice job. We did have another, kind of the runners up included that first one to decrease negative consequences of alcohol consumption and develop disincentives. So if you want to speak a little bit to that, Maureen, that'd be great. And we can keep going.
Sure. Density is a really complicated piece as you get deeper into it. It's not just the number of licenses per capita, right? It's also what type of licenses and how close, obviously the dense piece is, how close they are together. And so there's certainly some merit to some of the other answers about decreasing negative consequences. It can make it easier if there's not as many alcohol outlets. And when I say outlets, I am talking about both on-premise, bars and restaurants, and off-premise. And then disincentives for individuals. So again, if there's not places to go and drink, obviously that is helpful. But we do see it more as, really reducing those overall risk factors. So thanks for playing.
Mhm.
All right. So we've talked about alcohol policy. I've given you some examples of them, but there's a lot more out there. So just wanted to point you to a couple of places that we find to be really excellent is the community guide. Um, and so if you're on the CDC website, you can often find this where it talks about, what are the policies that have really been looked at and vetted in terms of evidence base through the community guide. And then what works for health is also kind of grades different policies and how effective they are. And so it can really look at, again, that evidence, but, give you an idea of what might not be a great fit, because it's important to know what works as well as what doesn't work, because sometimes those kinds of things get um, used, and you want to make sure that while you've got folks excited about alcohol policy or system change, that we're really heading in the direction of the best evidence. Oh, there we go. Also, just before I go into this slide, some other places you can find additional resources. The U.S. Alcohol Policy Alliance has a great um, piece on those. The stopalcoholabuse.gov, which is the coordinating committee on prevention of underage drinking, and Learn the Law, Preventing and Reducing Alcohol series through SAMHSA. So those are in the reference guide as well that you'll get at the end of the webinar. So model policies are great. It gives you a place to start, but it doesn't mean that it's going to work exactly in your state. So there's definitely a regulatory and legal framework for that. And so those are important things to consider. And you may have resources already in your state that kind of go through that. So for example, we've developed kind of a guide for Wisconsin where the CDC and I think the stopalcoholabuse.gov has 26 different suggestions on reducing underage drinking. Those are not all legal in Wisconsin, for example. So, there probably is a resource that you can look to make sure, does this fit within the regulatory and legal framework? Whether or not you're a control state really makes a difference because it also tells you where you need to work, right? Is it local, is it state, or is it a combination of both? Constitution can definitely make a difference as to what policies you could be doing. And then there's, of course, legal precedent, which is an example. So for example, um, in our state, we aren't able to do checkpoints, sobriety checkpoints, because of a legal precedent. So sometimes it's not written in law, but it's important to have folks that can make sure you check that out ahead of time before you get heading down a road and then find out that there's legal precedent that might not, that you need to get a law changed before you can put in the good law, for example. So, oops, didn't mean to do that. So the role of public health and advocacy. Now, you all might not consider yourself public health. I would if you're working on alcohol policy. Um, Public health is a pretty broad term. And I think it's really important that we think about what our role is. And so here's some definitions. Public health advocacy refers to educating, organizing, and mobilizing for systems change and population health. We look at current and future threats to the health of the community, how those are identified, and public health advocates work to inform, create, and influence change in the environment in order to create circumstances which make good, optimal health possible. Public health advocacy occurs through the media, legislative, and grassroots efforts. Although individual health advocacy for patients and clients can be practiced, and as I said, that's an important piece. It's part of the continuum, but it should be stressed that public health advocacy, like the core discipline of public health, is undertaken to enhance the health of the community through improved public health policy and program. So I think it's important to think about, we want to help the individual, and actually our minds are set up to think about, like we want to help that kid or we want to help that single mom, but how we're going to impact the most people really comes with policy and policy change. Um, and that public health advocacy is fundamental to the discipline of public health. So I think that's really important. So what is it? It's really understanding the data in our own communities. Um, it's also, being able to explain to the community and help them understand what are the problems, what are the concerns. So um, often states have, the burden of tobacco, reports that come out showing the impact that tobacco use has on the health of the community, the health of children being exposed to secondhand smoke. And then I think we're seeing much more commonly now rates of excessive alcohol use. And that's really an opportunity in my mind, whenever those reports are available, to talk to the public about it, and what excessive alcohol use is. Of course, the data is one thing, and we wish that everyone made decisions based on data, but they don't. Um, I think it's really important that we also use stories in order to help explain what's going on. So it's got to be kind of this combination of data and stories in order to really build that important community support, and really give the scaffolding that's needed by our decision makers in terms of making change. And I say decision makers because I'm talking, in alcohol policies, not all city councils, county boards, or state legislators. It can be hospital systems and health systems in terms of what do they do with their patients who are screening, of excessive alcohol use, right? Um, so we also need to think about schools, and other areas that we can help move people in the right direction. But it's not all alcohol policy is under legislation. Um, so we do remember stories more than data. Um, and I think that is a powerful tool. So I do pull from some of my tobacco examples, but I'll never forget when a man who ran a bowling center was testifying against the community going smoke free. And he drags his 11-year-old son up and he says, I'm not going to be able to send him to college if you change this law because no one's going to come bowling if we go smoke free. Made the front page of the paper, right? People remembered that story. It's not backed up with any data, of course, and that's not what happened. The community did go smoke free and his business continued to thrive. So, but it's important, stories make a big impression, and that's why politicians use them, and that's why we should also use story to demonstrate our point as well. Who can be part of public health advocacy? I think communities that are impacted. I think people with different backgrounds, um, are really important to be part of speaking about and, challenging some of the, dominant narrative about alcohol. Um, who is sitting there sabotaging some alcohol policy efforts? I think we see a lot of like big alcohol. In my work in public health, big tobacco, the big sugar industry, big soda, can make it really difficult because they've got the ear of a lot of decision makers. But, we can overcome that. We've done it before, we can do it again. And I think that's important because what we can do is we can show entire communities coming together on this. So folks that have been impacted by it, schools, law enforcement, coalitions, health systems, really can change that narrative in your community. So, in order to do public health advocacy, we want to think about some of those different roles. So, and I do want you to think about who plays those roles in your community. Who who do people listen to? Um, Public health experts, I think, have gone through a pretty tough time during the whole pandemic. But they're still often a credible source of information and where media go. But there's also an important role of educating the public. So, what is the problem? Why do we care about making changes? Because I believe fundamentally, if we don't agree on what the problem is, we are not going to get to the answers. So, it's really important to bring people, to see what's going on in communities and actually kind of open their eyes to it. It's also good, clean fun to educate our policy decision makers. So I'm going to talk about lobbying in a minute, but it is really important that they know what's happening in their community and what the impact is of excessive alcohol use. And really, the last one should be first is engaging the community, and by that I mean all kinds of aspects. I can tell you a story about how we didn't engage the entire community and we failed. Um, so, in a town that had a university system, and it was kind of like one of those town and gown places, but then had, a lot of manufacturing and, other jobs, went on working towards a smoke-free campaign, and that was on a referendum. And a few days before it goes to the public for vote, a priest stood up and said, "If this passes, we won't be able to burn incense in our churches." It's very Catholic community. And because they were not engaged in this work, we lost on referendum. So really, it shows that there's multiple people that you need to engage in the community. It's a lot of hard work, definitely worth it. And then, so maybe that priest would have said the same thing, but maybe there would have been another faith leader who could have counteracted what he said. So building capacity to advocate, I think, is also critical. Community members are essential to have working on this. And I know it takes a lot of energy to keep people engaged. But there's a lot going on right now in alcohol, both locally, statewide, and nationally across the country. So that should help. And you need multiple sectors. So, like I was saying, there's a place for the faith community, there's a place for law enforcement, there's a place for many different folks coming from different cultures and different belief systems. I think it's also critical that as you're thinking about advocating, that is not coming from one person, right? Um, we can easily be taken down if that main spokesperson loses credibility for some reason, or people just start tuning them out, right? So that's why you need to have multiple spokespeople, and I would say also from multiple different sectors, because there's different perspectives that are really important to include. Of course, we have to have the data and the research, and a lot of that really is just at our fingertips. Um, Hopefully your states also have some data and research that they provide, locally. That is super helpful. And I would whenever you can, advocate to have data and research that can be used on the local level. Um, we've encouraged like our quit line for Wisconsin to actually do it by legislative district. How many people use the quit line? So that you're looking at the data and the research about how effective that is, but also that lawmakers understand how many people are using this resource. And you have to have media relations, and media relations is kind of a moving target, right? um, I still think a lot of those main media sources are important in order to show kind of that third party validation, right? So when you get an article in the paper or you're interviewed on TV, that's really important to share on social media. But there also may be social media sites that you need to reach out to and engage with. And as we're going along here, please feel free to throw any questions in the chat. Um, Love to hear from you. So, understanding the lobbying fundamentals. So, I was talking about advocacy. Now we're going to talk about what lobbying is. And what I'm going to talk about is broad, right? So, your state or local lobbying laws may differ from this. So, I'm going to kind of focus on what's federal and probably likely most states. But it's always important that you understand what level of government you're working in and being aware of what those regulations are. We find that school boards often are an exception, meaning that you can talk to school board members as much as you want, and it's kind of below the lobbying line. So it's really important to understand your state lobbying laws. Some organizations are really nervous about it and they want to stay out of lobbying completely because it is complex. But you can also get clear guidance as to what is lobbying and what isn't lobbying and who can do it. So I've also found that sometimes I have to educate lobbyists on what is and isn't. So I'll give you an example of that. Um, when I was working at an endowment, we were working to increase pharmacists' ability to vaccinate folks, and this was pre-COVID. And so we actually set the pharmacies up for dealing with COVID because of the work that was being done. But talking to our state health officer about this information is not lobbying because it's below the lobbying line, right? So there's certain, and this is important to understand for your state. If we'd gone to the DHS secretary, that would have been lobbying. But because the health officer is several lines down, you can't technically lobby that person. So it's important to understand who you can lobby and who you really can't lobby just because they don't fall under the lobbying laws. Um, so there's some federal definitions that we're going to talk about as well. So federal definition of lobbying is oral, written, or electronic communications to a covered legislative or executive branch official in intent to influence the formulation, modification, or adoption of federal legislation, the administration or execution of a federal program or policy, the formulation, modification, or adoption of a federal rule, regulation, executive order, policy, or position of the, in this case, the US government. And then also lobbying is the nomination or confirmation of a person selected to confirm in the US Senate. So some of that doesn't apply to us at the state level, right? But for example, you can lobby a governor, right? Members of Congress, US senators, but also state senators, state assembly people, executive branch officials, so the DHS secretary, for example, mayors, city council member, county board members are part of lobbying. So why am I saying all of this, right? Because I really want you to understand two main rules about lobbying. It's when you ask somebody like a governor or a state representative to do something on a particular specific piece of legislation. So you're asking a person who can make a decision to vote for, vote against, rewrite, whatever, a particular piece of legislation. Those are the main two parts of lobbying. Now, there's a lot of nuance in terms of grassroots lobbying and other pieces, but for the most part, if you are not asking for a specific action on a specific bill that that person has control over, it's it's not necessarily lobbying. If you're telling other people to go talk to that person, it is lobbying because that's grassroots lobbying, right? So it's really kind of thinking about those two big rules will keep you out of trouble for the most part. So when you're thinking about lobbying, there's some things you should consider. Um, does your organization have a registered lobbyist? The reason why I put that in there is because that changes what is reportable, right? So if you don't have a registered lobbyist and you're a 501c3, that can change because there's so many days, generally speaking, that you can go and lobby, but not be a registered lobbyist. If you have a registered lobbyist, there's generally reporting requirements for contact between state lawmakers or federal if you're working on the national level. Um, do you work for a 501c3? Again, there are rules around that. Um, Other types of organizations like a 501c6, so often your professional associations. And do you have funds? Like if you're 100% federally funded, you can't lobby. There's a lot you can do, but you can't lobby. Do you have other funds that would allow you to lobby? Also think it's critical to understand how your organization interprets the rules and the corporate counsel. So those are really critical people to make sure you're engaging with if you're thinking about lobbying. And there's often reporting requirements. But you as a citizen have the right to have conversations, right? And you might be, on your day working for a particular association, so you're not being paid by government money and you're representing an organization. And so then there's opportunities, of course, to do that. I recommend three things to think about when you're using your own role, because a lot of you have kind of public roles, but your own time, your own dime, and your own equipment. So if you're representing yourself as a citizen, and again, own time, own dime, own equipment, um, that's what I like to say is good, clean fun. The other thing to realize and think about is your own legislator represents you. So again, I would say own time, own dime, own equipment, but you can certainly let your own legislators know what's going on. Um, that's kind of free speech. I would caution you to not do that during work hours if you're, federally funded or have state dollars and are restricted. But you can talk to your own legislator. And when I say legislator, I'm thinking state assembly, state senate, and even governor. I would also say don't be a frequent flyer. So, make sure they know who you are and that you share things that are important. But you don't want to be sending, 6 emails every week to them. So just kind of a cautionary tale there. And again, please feel free to put questions. I'm happy to answer questions as we get along. The list now that we're going to talk about is what is not lobbying. And I want you to note that this list is longer than what is lobbying. So making sure people know what's going on in the legislature or your county board, you can give updates about what is happening. It's important not to put editorial comments in there or, say like, hope you talk to your legislators about this. That would not be good. But providing information about what's happening in legislation and providing information about what's in legislation, you could certainly do. It is really hard to lobby through the media. And so mass communications, speeches, articles, publications, other materials, and making sure people have that information is really important. There is one way you can lobby through the media, and that would be to tell people to call their legislator to take action on something. But other than that, almost anything you do through the media and mass communication is, again, good, clean fun. On the federal level, testimony given before Congress or submitted for the inclusion of the public record is not considered lobbying. Um, on our state level, we have an option of providing information for information only, and so that can be done. You can also provide testimony if you're invited by the committee to do so. And so, you know, we really had a recent opportunity to do that in a community that was looking at changing their density ordinance to allow more because it's economic development, not thinking about the downside of having too many alcohol outlets. And we provided information to the committee about what that means and what alcohol density is, did not speak about the particular piece of legislation they had in front of them. Um, Sometimes given enough information, people make the right decisions, and that was the case. What is not lobbying? Again, if you get a request from a legislator, from a city council to provide information in writing, that is not considered lobbying. Again, if you're providing a request, a response for a request for public comments, that is not lobbying. And then obviously subpoena or civil investigation, and then again through the media, providing information. And that's what the public needs often, because they hear one side of the issue, like, oh, this is great, we can have more brew pubs, and brew pubs can have all kinds of different kinds of liquor. It's not just their own, and isn't that wonderful? But maybe they need to hear kind of the flip side of what happens when we have too many of those in our community. So in summary, it's important to make sure that your coalition and your organization have a clear definition of what is advocacy and what is lobbying. They have different roles to play. I have to say, as someone who has been a lobbyist, the biggest influence are people in the district. Um, so is to me, the actual asking people to vote a certain way is icing on the cake, but the whole cake needs to be built, right? And that's advocacy. So there's so much that can happen and should happen in terms of making sure the public understands what's going on and educating lawmakers about the information we have, so it's just different roles. I also think it's important to think about who's best positioned in each role. You really want to make sure you've got credibility. Um, and so having researchers talk about their research, having people who work with media talk with media, right? And then community empowerment. And I'm so happy that this group of folks have said that that's been a lot of their role, is to empower folks to talk for themselves. Um, and lobbying is critical, but not everyone needs to do it. There needs to be an overall coordination of that. But what if everyone just talked to their own legislators, right? A lot can be done just with that. So, and I have to, so I'm going to tell you a quick story. I love stories. The Wisconsin Public Health Association was dealing with taking away local public health authority. So a lot of legislators were mad about what happened during COVID, and they decided that public health folks should not have the authority to close down businesses more than 14 days, and the only way they could keep that closed would be a supermajority of the county board, for example. Well, this brings up a lot of problems, because a lot of things do not dissipate or go away in 14 days. So there's numerous examples of infectious disease, water contamination, all kinds of things where, you do need to shut things down for longer. While our lobbyists definitely did a great job, I think what won the day was a relationship that a local public health officer had with her legislator, who was the key author on this bill. And she made sure he understood the implications and how much more there is in public health than just dealing with the pandemic. And that legislation got changed. It's actually being sent to the governor right now, and it is not as restrictive as it was. It's a 30-day, which is better, and then you could get it passed for another 30 days. So it was really about that relationship between their own legislator and the credibility they have in the community. So I just think that that's so powerful to show that those relationships really matter, and can really change the trajectory of what's happening. All right. So hopefully now you're clear on advocacy and lobbying. You understand some of alcohol policy. So now we're going to talk about how we get started. So there's action steps to planning policy. So identify the problem in the community. You probably have already done that, right? A lot of you have had, the community health assessment, the CHIPS, the CHAWS, you've got the data, you've got an environmental scan, or you've got a community that has come together to say, look, we really have a problem about what's happening in our area. Um, so identifying the problem, I think, is really important. I'm sorry, I'm going to back up a second before I move to this. And I say this in the community. So are you working with a wide variety of people and populations in your community? Because that's critical. Um, to make sure that we're addressing and dealing with problems that people see, whether it's health disparities or just the challenges that different communities have, with alcohol. You do need to get leadership buy-in, and we're going to talk about that a bit more. Where can you make the change? And I know that sounds like an easy question, but actually it's a little bit harder than you think, because you really have to know who are the decision makers that can make the change you want, that you've built from the ground up in the community, and that you've got leadership support as well. So identifying the problem, knowing what the data shows and being able to convey that information to the public is a skill. And so it's really important to make sure you've got folks that, you know, have that ability. But it is important to use assessment data with the caveat, some of our populations don't show up because there's not enough data. So in Wisconsin, there's certain places where Native American data is excellent. And then there's certain places where we don't have enough data from the tribes. It doesn't mean they're not being harmed, but you do need to consider that. So um, I do encourage you to use assessment data, but if you're working with tribes, I encourage you to sit down and work with the tribes, right? Because they will be able to tell you how their community is being harmed. And then who's most impacted? So who is bearing the brunt of excessive alcohol use in your community? Making sure that those folks are engaged as much as possible from day one. And then make sure you understand the problem from many different angles, and that you're looking at that engagement. So I would love it if folks could chat some of the ideas that they've used in terms of engaging the community. Like what have you done to make that work?
Thanks. I think this is a great question, and I'll be watching the chat to see what people can share about ways they have or would like to engage their communities. So I am just watching the chat. Don't all jump in there at once. Environmental scans, says Savannah, is one way.
Well, you're thinking about your answers in the chat. I also think um, it is those stories that you hear from the community that is an important piece. And sometimes we don't have, like I said, enough data for a particular population. For example, there's many communities that have a pretty large Hmong population, but the way we collect data, they may not actually be identified as Hmong. They might be identified as white or as Asian, and that's a huge um, context. So I think that's important to think about. It is really important to reach out. So I love hearing about photo voice
Mhm.
campaigns with the youth.
Yeah. Outcome evaluation surveys, photo voice campaigns, which you just heard about, needs assessment in the county and social norms issue around social hosting. So focus groups along with surveys, it's great. I hear more surveys, attending summits, key leader interviews, town halls. These are all great.
So, and I love those town halls, summits, and all of those kinds of things. Collect who's there, make sure there's sign-in sheets so that you can get in touch with folks and make sure that that's not the end of the event. That's really, you get people there and interested, and that's how then you work to engage them. Um, I know
That's
we
great.
developed a piece to show how many ways can you use a meeting to your advantage instead of just coming in giving the presentation, right? How do you then take that audience and pull the folks who want to work with you along with you?
Great. Yeah, such a great point that those meetings and those events are starting points and that the follow-up is key to really moving the work forward. What a great, what that's really helpful. What a great point. Others? And if not, Maureen, we'll just kind of keep going. Feel free to keep writing in that chat. I'm still watching it as we move forward.
All right. So, who is impacted? And I've been talking about this. Um, and, and a lot of times, especially with alcohol, we see a private profit and a social cost, right? Um, and how people respond to that and practices that they have. I think, it's really important to have folks involved. Like, for example, folks who run domestic violence shelters, it may not be that it's the right time to bring in victims of that type of violence into that work. Hopefully, there is a time to do that because that's really important. But thinking about those domestic violence shelters, are they having fundraisers at breweries? Um, you know, are there charity events that are focused around alcohol in some way or another? So you've got these great organizations and causes, and then they're building that social norm that alcohol is normal and that we have to have our events around that. So just one of those kinds of things to think about. Um, And then I do want to just share another story about who's impacted. So years ago in the city of La Crosse, Wisconsin, there were young men who were drowning in the river. And the community called the FBI because they thought there was a serial killer. It was killing young men, college-age men. Um, and they did an investigation and realized that it was the overservice um, of bars in that area and excessive alcohol use. So they had a community that had a giant festival for Oktoberfest, and they actually fenced off families, and people could just drink everywhere. So after a decade of work um, and working with the Tavern League in their area, They were able to flip things around. Um, I'm not saying no one's drowned in the river since, but it's certainly not like it was happening. There's been a lot of change and enforcement of laws. But that big festival, because of who was impacted, it was families, it was college age kids. They've really changed that festival because that's right in the middle of a semester. And now the people who are drinking alcohol are fenced off. They have to wear the wristbands and show their ID, and the families run free, right? And so it can show that by working and thinking about what's happening in the community, even though they had like the wrong first initial idea, because it brought so much press, it really engaged the community on many levels, and they were able to make pretty significant changes, with that. So I think, again, I can't emphasize enough, building from the ground up, the people that are most impacted, and really thinking about different cultural perspectives on this. Um, Sometimes there's an urban rural divide on things, and then, obviously bringing in those experts and those grass tops. So we're going to talk about this a little bit more. An equity lens is a process for analyzing, diagnosing the impact of the design and implementation of policies on underserved and marginalized individuals and groups, and to identify and potentially eliminate barriers. So it seems like a lot of this group is already looking at those things, but it's got to be part of the work all the way through. Um, I know sometimes in the early years when we really started thinking about equity, it seemed like an afterthought, but now it's, hopefully in the forefront of how we look about look at this. So using that health equity lens, when you think about educating the public, is our communication planning making sure that we've got Hmong speakers speaking to Hmong people, right? Do we have tribal leaders speaking to tribes about alcohol? Um, those kinds of things are really important, um, as we develop the whole kind of campaign that you're going to be working on. And cultural humility. Um, and honestly, I feel like this should be part of how we work with everyone. Um, so that's my own personal approach, is really to think about where people are coming from and what their history is with the issues, the cultural norms, the existing relationships that they have, who works best with whom. And sometimes as, the white blonde headed chick, I'm not the one, that should be approaching some of these partners. Um, and that's okay. Um, if you're not the right person, you're not the right person, and allow space for that. And, having other partners, um, work in the community. Um, Making sure that information is culturally responsive. So I think there's many, many, many examples of that. But certainly in the tobacco world, it's commercial tobacco because tobacco is spiritual in the Native American culture, for example. It's also important to take time to build relationships. I now come from an academic institution. We're not trusted everywhere, as you can imagine. And so it does take time to build that relationship and build that trust and get to know people. So take that time. And being culturally humble, I think is really important. And there's a great definition that I found from a public health physician, Melanie Travan, and health educator, Jan Marie Garcia. um, it's really a lifelong commitment to self-evaluation and critique, to redressing power imbalances and developing mutually beneficial and non-parentalistic partnerships with communities on behalf of individuals and defined populations. Um, so that definition was introduced in print in 1998. So it's not a new idea. I think it's really important that we all are humble and think about, we don't know always what's gone on, or most of the time we just don't know. And it's important to allow space for people to make sure they tell us. So notice I started with a community. I think that's important. You also need leadership buy-in. And I am not talking about decision makers here. Like I'm talking about decision makers, but I'm not talking about legislators, right? Um, this is important community leaders. So the head of your agency, for example, health officers, CEOs of hospitals, the police chief, the county sheriff, you know, and so that is important, that we engage our own leaders. So I've seen this happen over and over again. Someone gets really excited about policy because they've seen that it passed somewhere else. And they say, well, let's do this in our community. And there's just a gigantic mistake of not understanding how much community support is needed in order to pass alcohol policy changes. And so it's really important that you've got the community behind you before a politician goes out and says, yay, this is great, let's just pass this, when they haven't thought about kind of the impact on the community, how the community might want to shape that proposal, and to make sure there's a lot of buy-in, as well as the time that it takes to educate other policymakers. Um, and obviously, we've talked about data, thinking about what the impact of this can be. And then I talk a lot about return on investment with leaders. For example, from the National Safety Council, for every OWI, it costs on average $1.7 million. So if you could think about how do we reduce that cost? Now, granted, a lot of that is insurance related costs, but it's judicial costs, it's police time, it's, community time that goes into that, healthcare systems, all kinds of things. And so a fatal WI is, looking at preventing that can be a huge return on investment. Oops, yeah, there we go. Step 3, where can you make that policy change? Be clear on where your goal is, um, and who makes the decision. So I worked on tobacco policy, and then I started working on food policy, and we're like, oh yeah, we need to change the um, buying practices of schools so that they do more farm to school, right? Oh yeah, we'll go talk to the school board, and they're like, we don't make that decision. Then we go and talk to the wellness committees. Well, we don't make that decision. I'm like, well, who makes that decision? It was the food service director, right? So who do we need to be talking to? It was the food service director. We had gone through several different places to figure out where that is. So I think that's important to understand who makes that policy change that you want to see happen. It shouldn't take you too long, but it's really important to know who can make those changes, who's in power. And then thinking about systems change, like what are changes within healthcare systems, who all needs to be involved in those, and usually it's multiple partners. So it's really important to be aware and think through where you can make that policy change, and also how do you make it stick. When I've done a lot of systems change work, not only do I want the decision makers, I want the people who are going to deal with the issue on a daily basis. Like now they're changing scheduling issues because they want to make sure that those well child visits also have a visit with the dental hygienist, right? So that impacts the person who's doing the scheduling, and they need to be part of that process, right? So it is important to think about where you do the policy change, but it's also important to think about who is going to be impacted by that, and can you work with them to make sure you're coming up with the best answers. Um, and then have engaging those different decision makers, and also making sure you understand your decision makers. What do they think? What do they do? So for legislators, I follow newsletters, I follow them on social media. I keep track of their local papers if they're really critical and they chair a committee, for example. So it's really important to get that information. and understand who holds formal or informal leadership roles. So I think it's important to know who your decision makers are and understand them. And also, when possible, find areas of common ground, right? Um, that I think is important. Sometimes, like on the local level with policy, it's the city clerk that knows what's going on. And important to find out what they know, what they think, who they would recommend we talk to. All right, so gonna review. Oops, I'm so sorry. I did not mean to do that. Review action steps. And I think we have a poll too. Um, so just identifying the problem in the community, with the community leadership, where you make the change, identifying your decision makers. So which steps are you confident
Great. This is
implementing?
such a great question. And we see people coming in now with lots of different answers, which I think really as they're coming in and you see the kind of um, I think some of it really uh, follows what we heard in the beginning around people's where their role is, which is educating others and to make that change. And so what we're seeing is identifying the problem is in the community is really the primary place where people are the most confident in building leadership buy-in and determining where to make change. Um, some folks aren't feeling confident, which is understandable, and I really appreciate your honesty. I'm going to give you guys about 20 more seconds. We have about half the folks responding, so I'd love to see everybody else like quickly tell us where they feel confident. Okay, well, with little more, with about 65%, almost 70% reporting that identifying the problem in the community is really the top identified place where people are feeling the most confident. Maureen, does that feel like that kind of tracks with what we heard early on our polls?
Yes, I do think we often identify the problem and then it's kind of what do you do next? So you know what needs to be changed, but then how do you start really building those steps towards change, building that capacity um, to make those changes? And it can be scary going and talking to leadership about, hey, we have this problem in the community. We've and y'all are, from the chat I've seen, you're doing surveys, you're doing assessment data, you're doing focus groups, you really know and understand the problem. And then it's really getting that leadership buy-in, to go forward and have that support. Hopefully some of those leaders not only buy in, but you can also get them to speak out when it's important that they do so. Um, and it looks like people are also somewhat confident in determining where to make the change. So that's good. I always like to kick the tires on that one to make sure, especially after I did it wrong. um, and then understanding who those decision makers are. So I think it's important that you get on lists and you have city council agendas, county board agendas, or, get notifications from different committees. You can do that on the state level, on the local level in many cases. Sometimes the smaller the municipality, the harder it is, like town boards and things like that. Um, but there are routines you can build in to make sure you know what they're going to be talking about, and understand who makes what decisions, and how that works. All right. Again, thanks for those who participated in that. All right, let's go to questions. I kind of dumped a lot of information on you quickly, so look forward to.
Absolutely. That was so good, so helpful, so much information. But I'm sure that there is some buildup of some questions, and I encourage you to take the time to use Maureen's expertise while we're here. So I see the first question is, I'm trying to create a primary prevention program in Ohio National Guard, having trouble collecting the right data to turn into information that we can understand the problem. Do you have suggestions for new programs to where to start collecting data or what basic data to collect and work from? Such as incident data or prevalence data. Carla says she agrees. Where would you suggest people find the data to help identify that problem before they move forward with specifically around policy?
Yeah, that's a great question. And not one I've been asked before. So thanks for challenging me. Um, my guess is that there's probably some data within the military that would be available and accessible, you know, that could be helpful to you. And can I ask, um, so you're looking to create a program with the National Guard. Okay. Um, so I think understanding usage rates would be really helpful. There may be incident data that you could get from police departments. For example, our Department of Transportation collects, all the OWI information, and then that is publicly available. So you can see the number of incidents that, might be around where people are gathering, for National Guard. Um, I think that would be critical. There's the CDC definitely has the BRFFS, right? Did I say that right, Aaron? Behavioral risk factor, you know, and
Mhm.
while that's not specific to the National Guard, it could certainly be specific to your state. Sometimes there's county level data that might be helpful, depending on if you're looking at, where they're coming to recruit and train, or if you're just looking statewide. Um, and sometimes you can ask for data to be split out. Sometimes they ask whether people are military or veterans. So that might be an opportunity. I
Absolutely.
don't know if
You might,
that's helping.
yeah, I think those are great. I mean, surveys in your state, national surveys that kind of can get to some of how policy has changed. Conversations also, so qualitative data to understand how policies are changing or policies are impacting specifically individuals who live near those National Guard installations. So if you're looking to do a local program, you'd want to look at that. If you're looking to do more national stuff, um, I would encourage you to look at national data such as you mentioned NISDA, the National Survey on Substance Use. Substance Use
That
and
one?
Drug. Yep. I never remember the names, but there's lots of data sources out there that can help you, and also just conversations with state and local prevention folks who might be able to direct you towards both um, resources on policy that have been developed or are currently implemented, either at the state or local level. Those folks are often huge resources. Um, some people who are already doing the work in the area. So Mike's asking, can you talk more about whether your organization needs to have a registered lobbyist, or did you say your organization should have a registered lobbyist? So kind of where do we land on the need for that? How important is it? Is it essential, or is it kind of a bonus?
That's a great question. It kind of depends on where your focus area is. If you're looking to change school policy, for example, you don't need a lobbyist for that. If you're looking to change city policy and cities are regulated under the lobbying law, then I think it's important that in your coalition, there would be somebody who could lobby. I don't know, not every organization needs a lobbyist. And again, I think like 90% of the work is not lobbying, it's advocacy. So when I was a lobbyist, I'd be at the Capitol and I would track every minute that I was at the Capitol talking to folks. But honestly, even those conversations were almost always educational. Like they didn't know information about what was happening in their own district, or the impact of whatever I was talking to them about. And so there's tremendous value in having people who can talk to decision makers, um, and not necessarily be lobbying them. Of course, it depends on your funding as well as to what you can and can't do. But I don't I don't think every organization needs a lobbyist. I just think within your coalition, it's pretty nice to have somebody that can do that.
Great. And it looks like James has provided some really great resources there. Thank you so much for putting those in the chat and helping each other. That's why we come together, is to learn from each other. We do have a reminder that we'd love to see you take our evaluation survey. The link is there. Chris Gabrielson has also shared with us that we do have some more advocacy training coming up. And I think if there aren't more questions, Chris, did you have some, did you want to share with us some upcoming events? I feel like.
Oh, feel free to do that if you like. I think they're on the next slides, I believe,
Oh,
but
okay, great.
unless you want me to.
No, that's fine.
Okay.
Wonderful. So so Chris Gabrielson is just with us, and she is the director of the Great Lakes PTTC. So we're happy to have her with us. We do have 2 more events on this topic where Maureen will be presenting on how COVID changed alcohol policy, which is like a very fascinating, important conversation for us to have. And then we'll talk more about diving into implementing the strategy. So today we talked about a lot of what you need to do to prepare for and to get ready to understand policy and policy change. And in that third June 29th one, we'll be talking about kind of approaches to planning and implementing specific alcohol policy strategies in your community, kind of getting you ready and demystifying that work. Other upcoming events, we have a Change Leader Academy, which is going to focus on using continuous quality improvement in your prevention work. That will be July 11th, a 4-part series starting on July 11th. We have a great effective group facilitation skills for prevention professionals coming up on August 24th. Really excited about that event. It's a key skill for prevention providers. So we encourage you to think about that one. All of these can be found on our website. You'll see there's a URL up there, and if we can post that in the chat, that'd be great. Engaging youth in substance misuse prevention, with that on the 29th. And the importance of advocacy, like excuse me, as Chris mentioned in the chat, we do have one that'll get a little bit more in depth on how to engage in advocacy and tips for conducting it, a little bit more into the nitty gritty of advocacy. And that's on September 20th. So if you want to join us for that kind of continued work, Shannon has put the link to where you can go to our go to our evaluation as you have to log off. We also have this, can we go back really quick?
Yeah.
That's okay. We have this really great new resources for Great Lakes, which is a guide to beginning your journey. So for those of you who are either new to the field or have staff colleagues who are new to the field, maybe even coalition members and partners, this is a great resource to help you understand and get access to a number of resources on a myriad of topics. It's organized by topic area, and then gives you just an absolute wealth of resources. You can download that new resource there at the link in the chat. Encourage you to take the time to do that. And again, here is our post-event survey. It's incredibly helpful for you to complete that for us as we continue to work to improve our own work. So I mentioned before, we do continuous quality improvement prevention. We do it here ourselves, and we encourage y'all to support us in that work. So there are some references here, and again, you'll get the slides. We want to take the time to thank Maureen for being here with us. And again, you'll see links just kind of continuing to come up here in the chat around registering for upcoming events, doing our evaluation, and downloading our new resources. So we hope you continue to join us here on the Great Lakes PTTC for future events. including the 2 remaining webinars in this series on alcohol policy. Thank you all so much for being here. And you've been a great audience. And Maureen, thank you for your time and expertise today.
It's always fun.
Great. Thanks, everyone.